Donna, did it let you come right in or did you have to fill out the registration?
I had to fill it in.
Oh, okay. I thought it was direct.
So good afternoon, everyone. My name is Donna Houle. I'm a senior director with the Military Women's Memorial. And today we are bringing you the third in a series of three health seminars with the HunterSeven Foundation. And we have met all kinds of participants with HunterSeven, and Chelsea Simone will be sharing her connections with a few of her other colleagues and introducing you to their medical history and telling you a little bit about their actions to get better and to be participating more with HunterSeven and their care. So Chelsea.
Thank you so much for having us and allowing me to introduce these three incredible human beings. It is a very humbling experience to have met each of them and listen to their stories and to hear about their service and their sacrifice. It's something I highly recommend everybody take a listen to, if it just gives you a sense of morality. So, a little bit of backstory about the HunterSeven Foundation. It was founded in 2018, December, by myself and by my husband after he mentioned his Sergeant Major, Rob Bowman, had passed away from cholangiocarcinoma at 44 years old. His call sign in the military was HunterSeven, so that's where the name kind of came from. And so the reason that we started this foundation was because we wanted to see how many individuals were affected by this. And there was a huge gap in research. And so with that, we kind of said, okay, where can we fill this gap? How can we address these needs that aren't being met? And so we started off with research, and then we began educating providers, educating veterans, educating the VA, DOD. And then we kind of found, okay, this is a lot deeper than we assumed it was. There's a huge gap in care. We see a huge gap in care being attained, not just with the VA, but a good majority of post 9/11 veterans utilize civilian providers. And as a civilian provider myself, we identified that gap and said, how can we close this? How can we do a better job identifying post 9/11 veterans, identifying their risk factors? What can we do better to assure that everyone's needs are met? And so with that, we kind of jumped back to early identification and management of symptoms and management of a condition. And thankfully, it's worked out very well thus far, but there's always room for improvement. So I'm definitely honored to even mention and be in the same chat as these three individuals, all of which are military veterans and cancer survivors, authors, parents. It's incredible. It really is. So, Kayla, Brandi, and Joe, thank you very much. They're gonna give you a rundown of their story because each of them have such an incredible story of service and exposures and seeking care and their treatment. And it's just an incredible experience. So Brandi, if you want to get started, I'll let you go first.
All right, so thank you so much for having me. It is a pleasure. I am so excited to be here, and thank you to everybody who's joined and taken time out of their day to come and sit here and listen to some very educational stories and information, because it's really important that we not only know that, yes, cancer happens, but you can thrive after cancer, but then there's also this amazing organization, HunterSeven, that is educating, bringing awareness, and driving the needle to everything that's happening. Because honestly, without this organization, I do not believe that bill would have been passed. All these great things are happening. So thank you so much. Super humbled about that. So I'm Brandi Benson. I am a Ewing sarcoma cancer survivor. I'm also a veteran. I was in the US Army. In 2008, I was deployed in Iraq. I had just graduated from AIT and basic training. So I literally went straight from training right into being deployed. So I was at my main duty station for 1 month and 9 days, and I had to go straight to war. Of course, we're scared. We don't know what's going to happen. I was only 24 years old. I literally just swapped out my college books for M16. I just learned how to clear a room and do all these like really cool, fascinating things. But now I had to put all this into actual actions now. I had to really now do these things. And I was just scared. I didn't remember good enough. And was I really ready to be amongst all these, these men in the military? So it was very frightening. And of course, mental health came into play. But as time went on, I got used to it. And then around December in 2008, I was noticing that I was extremely fatigued. No matter how much rest I got, no matter what I did, I was just so tired. And I thought it was because I'm 24, I'm in the middle of a war, I'm away from my family, it's Christmas time, I'm missing my family. So I'm thinking all of these things and why I'm so tired is just externally, and it's just affecting me internally. Little did I know that I had something growing inside of my leg that ended up being a really rare and aggressive cancer called Ewing sarcoma cancer. And I didn't discover this until January, about a month later. This lump kind of just presented itself out of nowhere. I didn't know what it was. I never knew that you could get cancer in your leg. It just, I didn't know any of these things. I thought you got cancer, throat cancer, brain cancer, stomach cancer, ovaries and all that. So I wasn't very cancer literate on you can get cancer anywhere. I just didn't know that. So when this lump presented itself, this mass in my leg, I thought I originally pulled a muscle. And I was also 24, and who gets cancer in their 20s? Like, that didn't make sense. So I didn't think anything was wrong with me. So I kind of just, pushed it off for a while. Then I ended up showing a couple of friends, my NCO, the doctors, and everyone except for me was so concerned. And I'm thinking, why are they so nervous about this? Like, it's just like, I just pulled a muscle in my leg, like everything should be fine. So I leave and I go from Baghdad to get a CT scan. And then from there, I go to Germany to get another MRI. When I get to Germany to get my MRI, I remember the doctor sitting me down and talking to me and telling me that it was a tumor. And I had never met anybody that had a tumor. I didn't know what a tumor was. I don't even know if I've ever came across the word tumor. Like, my whole life was basketball and soccer. I mean, tumor wasn't in my vocabulary at all. So that didn't make any sense. So I go and I'm online and checking out what this means. And so I now know that it's, it could be cancerous. So now things are getting a bit more serious. I'm understanding that this might be something really bad. And so I'm in constant communication with my mother at the time. And I explained to her what the doctors had told me. And I go back to the doctors and they take a biopsy of it. And I remember him again sitting me down and telling me that it could be two different types. It could be Ewing sarcoma cancer or nerve sheath tumor. And he said, I hope and pray that it's not Ewing sarcoma cancer. And I remember thinking, okay, I guess that's the better of the two. I'm not quite sure. So of course I do my own research, and Ewing sarcoma spreads to your lungs, your spinal cord, your brainstem. You'll definitely won't be living past 5 years. If you are able to make it past a year, they amputate that part of the body. So I'm hoping that I do not have Ewing sarcoma. And I've been diagnosed with a nerve sheath tumor. So that's what they tell me I have. So I get to Walter Reed, and that's when everything kind of just totally changed. I then get diagnosed with Ewing sarcoma cancer because they misdiagnosed me by accident. They had to do a new biopsy. So now I'm faced with this horrible, horrible disease. I didn't know what was going to happen. I didn't know what I was going to be doing. I was only 24 years old. I my whole life was flashing by my eyes. But during that entire time in that experience, I definitely learned a lot. Definitely from HunterSeven Foundation, learning what you're exposed to, the microplastics in the air, the poor quality of the water, the burn pits, the gases from the jet fuel, like all of that stuff matters. And if you've been exposed to that, like, you need to make sure that you understand what the possibilities or the outcomes can be, and being your own advocate is super important. So after all of those years, 13 years later, I'm here today working as well with the HunterSeven Foundation. It's just humbled that I'm able to be here to share my story with everybody, the world, anybody who has cancer or been exposed to any of these terrible toxins. but just letting people know that, yes, bad things do happen. Okay. However, you don't have to feel like your life is over just because you had cancer, because that's definitely not the case. Since I've had cancer, I've been able to write a book. I've opened up my own business. I've traveled all around the world doing amazing speaking engagements. I have an engagement with Rolls-Royce next week. I've done travel. I've done so many great things, and it's all started from having cancer. But I've been able to use my disadvantages to my advantage, and I've made it work. And I've kind of created from this mess, there's been a beautiful message out from it. And I think it's just so important to know that there are amazing things in this world that can still be attainable, even though you've gone through some really tough times. And I don't want to take up too much time. And so that's my story. And thank you so much.
You are one of the most motivating people. I feel motivated right now. That's incredible. Like I said, it's such a humbling experience to even speak with you on this. And thank you for sharing your story. I know it's not easy to remember. When you mentioned in your book, the doctor told you to get your affairs in order because you weren't going to survive, and your mother was by your side, and that unit at Walter Reed, there was 12 others and nobody made it out alive. And
Yes.
that God bless you for that. And we'll make sure we get a link out for that book. That's one of my favorite books, hands down.
Thank you.
So Kayla, you ready to go? Your story, you have another story that is totally incredible. I'm super excited to hear it again. So.
Hi, I'm Kayla Erkey. Thanks for having me. I was a medic in the U.S. Army. I got attached to Air Defense Artillery, and I hit my 1-year mark in United Arab Emirates. That's where I deployed. I was fine during deployment. Everything, I was a little tired, nothing crazy. And I presented a lump on my neck. I have a neck injury, just spinal, nothing crazy. Air Force doctor said it was just a muscle mass from my injury. Didn't think anything of it, redeployed. A couple months later, got back to Fort Bragg, and I started having some weird symptoms, heart palpitations, heat intolerance. I just couldn't handle my heat. I was pretty tired, but I was in the best shape of my life, didn't think anything of it. And I got seen by my PCM. She referred me to ENT, ears, nose, and throat, endocrinology, cardiology for the heart palpitations, bunch of blood work, everything came back fine. So I went to go get my wisdom teeth pulled, and the surgeon was like, nah, something's wrong. You need to please go back. And so I went back to my ENT doctor, and I was like, hey, they won't remove my wisdom teeth. They're saying something's wrong with me. And they're like, okay, let's just check one more time. And that's when they found the thyroid cancer, but it already has metastasized from my thyroid up to lymph nodes in my neck. And I had the surgery in 2013. I was just turned 25 years old, and I was told I was in remission. So I PCS to Fort Bliss, Texas, and they told me, they're like, you are definitely not in remission. They missed some tests. And that's the only time I've heard the word remission. And it's been almost 9 years. I've had 2 other surgeries because they now have spread to my left side of my neck. And this week, I'm actually waiting for my results to hopefully I'm in remission after almost 9 years. Yeah, that's for the most part it. I guess it feels 8 years have gone by fast and slow at the same time. I was a single soldier when I first got diagnosed. All my family was on the West Coast, so I handled it, I think, pretty well. But then when they for sure found the cancer again, because they didn't know where it was, when they found it again, I was already a mom. So I think hit pretty hard. The anxiety is definitely here now since I'm a mother. But yeah, that's.
You mentioned, I remember talking to you in the past, and you mentioned that there was one exposure you remember. And do you want to talk about that? What that was?
Is that the water bottle ones, or just all the radars?
Was it the mold in the
Oh, the mold, yes. In our barracks, we had 4 beds per barrack. It was an Air Force base, so I can't complain. It wasn't horrible by any means. That's why I call it a deployment. Yeah, the mold would get so bad if you didn't move boots or anything off the top of your wall locker. It'd be coated within a week or two, maybe a little longer. The whole AC tube for the condensation that ran outside would be so full of mold, you'd have to like poke it through. So the mold would go away. Down the hall, there were 4 females. They got, I don't know how, but they got new flooring. And I remember seeing them ripping up the, super thin carpet, and it was just mold everywhere. And then I was 20, I turned 24 on my deployment. I didn't think to get pictures. I didn't, smartphones. I mean, obviously there were smartphones in 2013, but it just, social media wasn't, I feel like, as huge. I never thought to record anything, take pictures. And I always thought I was on a cake deployment. We could have our, beer. And so I never call it a real deployment by any means. So I guess you just don't think of that stuff. And then I know air defense artillery has all the radars and all that technical stuff. And I know, talking to one of my old sergeants after I've been diagnosed and all this stuff, he remembers sitting in the aid tent, the first aid tent, and just feeling hot a lot, like, because the radar would be right above our tent, but you're not supposed to take pictures of anything. And like, looking back, I was like, yeah, I guess I did feel weird a few times, but then it's hard because no one will tell you for sure where your cancer came from. Cancer doesn't run in my family or anything, so it is hard to pin it down.
That's terrifying. And one of the things that Brandi mentioned in her book was she'd walk into her shoe, the Connex box they gave us overseas, and no matter what she did, she'd spray the mold with bleach. She'd do everything, try to scrape it off, and it would always come back. And I mean, I think that's one of the biggest things people overlook is those mycotoxins and black molds and different types of fungus. And it's crazy. Like, you don't think about it, but it's actually pretty detrimental to health. And a lot of the exposures that we see with veterans who hadn't left CONUS, who haven't deployed at all, we see a lot of them are diagnosed with these odd cancers. And you're like, well, where did it come from? If they didn't deploy and it's not burn pits, where did it come from? And a lot of it traces back to the molds. And so it's definitely a concern that is overlooked for sure. But Joe, I know you have a good story. Your stories are always, your story is pretty wild.
Yeah. So also, like, hearing both of you ladies, you guys are way harder than I am. Way harder than I am. That's not even close. So I was in the Marine Corps. I had 2 deployments, 2010 and 2012, both to Afghanistan. I was an enabler attached to Recon Battalion both times. First Recon Battalion in 2010, we were down in an area called Trek Now, and like, this is kind of like the epitome of the whole burn pit situation. We were in an area called 5 Points. It's like 5 smuggling routes that all intersect in this one section, and our whole job was just to disrupt all the smuggling routes. And so what we do is we would take a compound for like 2 or 3 nights, get in a bunch of firefights, tear down in the middle of the night, move about 10 clicks, set up in another compound, and do the exact same thing over again, and do that for about 60 days or so. Every time we tore down, because we would get a resupply from the air wing, they would drop us all sorts of water, chow, wag bags for our human waste, batteries, all that stuff. But we'd have all the stuff that we brought with us in addition to that. And so you had to burn it. There was no other option, because you could either, you're taking the 5590s, which are a giant battery that weighs about 8 pounds each. You're going to take that, and while it doesn't have enough battery left to utilize in our radios, it did have enough battery left to power an IED. So you can't just leave it. And then we would get water bottles, and water bottles, the Taliban and the insurgents would reinflate them, put a couple of pieces of metal in it, and reuse it as a pressure plate. So you can't leave those either. So your only option is to either carry it out or to burn it. And when we're bringing out enough water, I mean, at one point we've got dropped 2 pallets of water. There's no way that you can carry all of that stuff out. There's just not enough room in our packs. So your only other option is to burn it. And so next thing you know, you're burning lithium batteries and water bottles and human waste and everything, in the one corner of the compound, while we're all sitting on the other side of the compound going, this probably isn't healthy. fast forward after my 2 deployments, I got out, traveled around with work and various places. My wife and kids were actually living in Georgia at the time. I had just gotten a new job up here in Virginia. And so I was staying with a buddy of mine. I moved up here in December. I was living with a buddy of mine who had cats. I had never lived with cats. I started being itchy all over. Thought I was just allergic to the cats. So I went down the full gamut of, I got, steroid pack from a urgent care. I went to a regular doctor to try and get some allergy meds. She eventually referred me to a allergy specialist. The allergy specialist gave me some prescription strength stuff that didn't help. And then eventually, similar to Kayla, I started getting a lump in my neck, and I had a buddy who had some sort of a thyroid disease while he was in, and I was like, maybe that's what I got. So I brought myself down to a ear, nose, and throat doctor. He had me get a CAT scan. He immediately referred me to get a biopsy. Went and got a biopsy, a needle biopsy, and they were like, it's lymphoma. We don't know if it's Hodgkin's, we don't know if it's non-Hodgkin's, but you've got lymphoma. So they then referred me again down to George Washington University, where they did a full biopsy, cut my neck open while I'm awake, which was hands down the weirdest thing in the world, to have them pulling around in my neck while I'm awake and can't feel it, but I can kind of feel it. Really weird. Anyway, so they cut out a chunk of my lymph node, and it turned out to be Hodgkin's lymphoma. Grand scheme of things, I was kind of happy, as bad as that sounds, because I learned that Hodgkin's lymphoma is really easy to beat. And this is why I say these ladies are way harder than me, because I did 6 months of chemo, wound up getting an infection while on chemo, which is actually what got me hooked up with Chelsea, because I was in the hospital and for a week straight with this infection. And I was like, I have no idea how I'm going to pay for this. Luckily, I'd already reached my out-of-pocket max for my insurance, because I had a great insurance at the time. But that's what got me hooked up with HunterSeven, and basically that's what hooked me up with all of these other wonderful people who, again, are way more badass than me, because they've beaten or are beating better and harder cancers than I have had to deal with. And so, like I said, I'm here. I'm in remission. This is my second year in remission, I think. Yeah, second year of remission. So that's my whole story.
That is a badass story. Like I said, I can't believe the stories that come from you guys. It's incredible. And I mean, there's one comment from Messina. Joe, I also had Hodgkin's lymphoma. Have you had any other cancers since the treatment? I've been diagnosed with thyroid and skin cancer in the same area as the radiation I had during my first cancer. Stay vigilant. Oh, wow. That is intense.
Yes. No, so I have not had any other cancers. I actually did not do radiation. I did all my treatments through Johns Hopkins. Gosh, I can't think of my doctor's name right now, and it's going to kill me. But he specifically did not want to do radiation for that exact reason. He specifically said, we are only going to do chemo because of, like you put out there, the likelihood of getting a different cancer from the radiation was much higher than it was for just doing chemo, having the lymphoma come back. So no, I have not had any additional cancers, most likely because I did not do the radiation aspect of it.
Is that a common concern with radiation, targeted radiation?
That's what he told me. He said if I was older, he would consider it, but because I was only 29 when I got diagnosed, he's like, it's not worth it. So that was a concern that he brought up.
Yeah, and Messina, if you need any assistance, definitely reach out to me. If you need second opinions or alternative treatments for cancer, it's too easy. That's what we do. So please reach out to me personally, and I'll definitely get you squared away. That's not a problem. And thank you for sharing that. I know it's not easy to share things like that, but as Joe mentioned, you're definitely not alone. And these are great, amazing people to support, along the way. So thank you for sharing that. Yeah, I mean, does anybody else have any questions?
Richard Ambinder, by the way, is my doctor's name. If your oncology team is looking for somebody to look at, I'm sure he's got a whole bunch of stuff published, because he told me straight up, he's like, I'm one of the better ones. He's like, you don't need to come to me. You can go to somebody else for your treatments. And I was like, I'd rather go to you, because if something goes wrong, they're going to send me back to you anyway. So Richard Ambinder is his name, from Johns Hopkins.
Thank you for sharing that. That's impressive. Yeah, I mean, any other questions?
Well, I have a question about so the radiation, that's my next step, is depending on this blood work, I'll either need I guess it's the direct laser. So some of this stuff I don't even fully understand, and I've been dealing with it for 8 years. So I know my next step is either radioactive iodine again, or the direct laser radiation, because I also have lung nodules that haven't grown in 2.5 years, 3 years, but they don't know if that's my thyroid cancer spread further or not. So that's the next step I'm in, obviously.
Have you asked your doctor, your team, about any clinical studies that you might be available for?
That could be my next step. I know it's mainly waiting for the lab work to see. And then I know it's in my folder, but I get pretty bad anxiety now looking at results.
Yeah.
So depending, I would rather I'll let the doctor call me. So if I don't obviously hear in the next few days, I'll reach out.
And we can, Kayla, that we'll always help you get the best care possible. I mean, not to be cocky and, be that typical Bostonian, but we are in the nation's greatest area for healthcare. And I'll argue that all day. So, I mean, anything you need, we can get it like that.
Okay. I might be moving back to the East Coast. My husband's still active duty, and he's on orders for South Carolina.
Oof. Oh
yeah. Well, I'll go up further north for treatment.
Yeah, we'll have to chat about that after. Betty mentioned a question. Has HunterSeven or other organizations have been successful at FOIAing data from the VA on how successful vets with cancer are at getting service connection? So what's interesting about the post 9/11 era veteran is only 23 to 27% fully utilize the Department of Veterans Affairs, and majority actually seek care outside of the Department of Veterans Affairs. And so it's really difficult to get an understanding on how many post 9/11 veterans have cancer following service. What I can say is that there is over 560,000 post 9/11 veterans who were diagnosed with cancer serving during post 9/11 on active duty. That's the number. 500,000 were diagnosed with cancer during that 20-year time period. That is actual DoD data. In terms of cancer related to service connection, I don't have the data on that, but what's interesting about this is that it's fairly easy to get a service connection. It's just in how you word it. So it's very rare that we write nexus letters unless a patient has cancer, but we have 100% success rate because we actually take that diagnosis, and you have to have a diagnosis, of course. You can't, try to correlate symptoms with a condition, but having a diagnosis and actively having a disability related to it. And so, I'm going to use you as an example, Brandi, only because I've seen your leg. If it was that Brandi couldn't walk or couldn't work because of her leg and because of the pain, they would directly service connect her cancer and also give her a percentage based on the amount of disability she has. So you can be service connected and have 0%. Which, would mean that you're totally in remission, that nothing affects you long-term, but it's very rare. Usually these cancers cause a pretty drastic lifelong effect. So in terms of getting, successful service connection, it's usually not a problem if you know how to go about it. So, I mean, Betty, you and I can chat offline about that. I know a lot of the people that you work with are sick, and unfortunately, the aviation community gets overlooked. For those who don't know, Betty's husband passed away from cancer after serving in the Navy for decades, and being a fighter pilot, instructor, taught like high speed. You see Maverick, and her husband's the guy that movie was like made for. So he passed away from cancer, and so the aviation community, they're not spending time on the ground, you know, they're flying around. And being in aviation, I knew this. And so it's really hard to correlate service connection cancer with aviation because you're not around the burn pits, right? And so it's otherwise easy, but Betty, we can chat offline. We can get that done. That's not a problem. And Messina, I will drop my email in the chat right now. So if you need anything, make sure you reach out and let me know. But yeah, any other questions?
I'll add to the service connection thing, just because that's where I'm still kind of going through. Hopefully this PACT Act is going to make things a lot easier. However, so for me particular, because I was already out there, even Dr. Ambinder was hesitant to say that it was connected to my time in service, simply because, well, also because he's very well known for being a lymphoma doctor, but in general, it's one of those things where they're just like, well, what did you do? And I'm like, oh, I don't know. Sat next to burning lithium and breathed that in for months on end. But there's things like that where they're just not 100% sure on. And it does take a bit. Hopefully that changes again with this PACT Act and some other things. And also with all the work that Chelsea's doing, bringing the understanding around to both to the veteran community and to the VA and to the government as a whole. Unfortunately, one of the things that's just going to be is we are operating at the speed of government, which we all know the government is public money and it's time and it's slow. You just got to be persistent with it.
Slow it is, that's for sure. I am actually trying to get a service-connected disability because I was sick, had cancer, had a huge portion taken out of my leg, but they will not allow me to say that it was cancer or connect those two at all. So we'll see what happens with that, but you know, it happens.
Unfortunately, sarcoma, which is one of the most deadly, hands down, one of the most deadly cancers in the military that we've seen, wasn't added to the PACT Act, and we fought for that. We're still fighting for that. I spoke with Congressman Cicilline yesterday, and I was like, listen, I have a lot of people who are affected by this, and so we'll work towards that. And then the other thing is, you know, the PACT Act did give that 10-year leeway for VA enrollment. So I mean, we'll be able to get that. That's not a problem. I can assure you on that. We'll be able to get that. And let's see what else. Are there any? Oh, Sarah. Sarah is actually just commented, and Sarah is very smart. She is from a very great organization that I highly respect. Sorry to call you out, Sarah. Very, very smart, very smart. So she asked if there's any programs particular in the military community with for people with cancer diagnoses. And one of the ones that I've worked with that I know of is the Total Archery Challenge. Like that's one of the great ones. I know Kayla's heard of it. It's through Black Rifle Coffee, and they literally take you up in the mountains in Salt Lake City, Utah, and they do it at a bunch of different places. It's getting bigger, but they do a lot of stuff. And like when I say they take care of you, they hook you up with everything. It's such a good time. I went out there just to watch and hang out and drink coffee, and I had a great time. But there are some decent programs. There's a few other ones that I'll have to get you the list for, but I will get you that list. I'll make a note right now.
Shameless plug for
I have one in
myself. Any chance that
Washington.
I can get in on that? Next
That's what
time?
That's what I want to do.
Yeah, right. That'd be awesome.
Amazing.
It's a great time. I mean, they treat you really good, and yeah, yeah, of course, I can. You know, we can get you in on that. That's too easy. And I think there's something coming up with the Washington football team or the Washington Redskins or the Commanders, whatever they're calling themselves this year. But they've been excellent in doing stuff like I know they had Joe up there, and another team is the Broncos. I actually shared Brandi's book with a member of the Denver Broncos whose father passed away from sarcoma, and he's their best wide receiver. And so he actually is a huge fan of what we do. And so he's going to have some veterans out there. So in those areas, if you like sports, we could definitely do that. But the Total Archery Challenge is awesome. But we will get more information out there, and we'll send it over to Donna and her team to relay out. Betty, does the VA and DoD have education programs in place for? They do. So the medical provider programs are interesting, and every time a new one comes out, we do it. But they just did a certification program with the American, I want to say it's the American Association for Cancer Research. I'll have to find it, but it's very topical. It focuses on depleted uranium, the typical programs for what the VA has for their registry. So, airborne hazards and open burn pits is one module. They have one for embedded fragments from like IED blasts and the correlation with radiation related to those. They have different registries like that. So the program, it's very topical, but it's good. So it needs to get more in depth in terms of, if you identify somebody that has a risk for exposure like that, what do you do then? What blood work do you schedule? What types of scans do you schedule? Because that's where a lot of the providers throw up their hands and say, we don't know. And so, we spoke about infertility on one of the previous discussions with the Women's Memorial and the first one. And, when we say, if you have issues with infertility, find out what the root cause is, because 95% of infertility is reversible. You just need to find out what's causing that issue, right? So with infertility, it could be a variety of things, but you need to find out the root cause. So looking at blood work in terms of inflammation, how's your IL levels? How is your CRP, your ESR? Those aren't normal levels that you actively check for. And so going back and looking at those, looking at your thyroid levels, a lot of the times your provider doesn't check your thyroid levels because you look otherwise young and healthy. So getting those add-on tests and being transparent with your doctor and saying, hey, listen, or your provider. Personally, I see a nurse practitioner because I like them better, but I'm also biased. So, reaching out to them like, hey, listen, this is what I'm experiencing. This is what my history is. Voice that concern to your provider, because they will listen to you. They might be hesitant at first, but when you relay that information, they will listen. If they don't, you come to me and we'll figure it out for you. So, but there are some new programs on the horizon, Betty, and I think that'll be an interesting thing for sure. Chelsea, I have an attorney that
Question. So Chelsea, so you were saying about the infertility stuff. So I did like a ton of chemotherapy. I did 101 rounds of chemo in 10 months. I was literally like dead when I was done. And that made me infertile. So does that mean that it's reversible? Or am I just...
That might be a different story. We can,
okay.
But that's, the VA actually has a program. So if you have a service-connected illness, they'll actually pay for infertility treatments and different explorative type things. So we can chat about that offline. But chemo is a tough one. I first of all, I don't know how you survive that many rounds of chemo. That is,
it is a lot. It is a lot.
And I remember seeing the pictures of you in the hospital. Oh my God. I wish I should, that's what I should have done. I should have had the before and after. It's incredible. Like it stresses me out. It gives me shortness of breath.
Don't do that. We need you.
And Lauren, I will reach out to you. I think I know who this individual is that you speak of, but I'm not 100% sure. So let me shoot you an email right now. And Sarah works at Rand Corporation, and they are the leaders in medical research and all that good stuff. So I always appreciate what she has to say, because impressive, very impressive individual. Be your own best advocate. It's the best thing you can do. What's the info on previous?
On that be your own advocate thing, like I can't tell you how many of my friends have hit me up, and a lot of them have wound up not being anything major, which is awesome. But at the same time, I can't tell you how many friends hit me up after my diagnosis and were like, okay, what were your symptoms? Because I've got X, Y, and Z going on. And that's 100% the thing. And that's part of the reason why I was so open about all of my treatments and all of my symptoms and all that jazz, is because there were so many dudes that just, it's just this, that, or the other. Like it's nothing, it's not affecting me that bad. I was one of them. It was like, okay, I'm itchy. Like it's not that big of a deal, but I also spent 6 months trying to figure it out. And then eventually it turned out to be cancer. It could have been worse if I'd have tried to wait even longer. But That's 100% the best thing that you can do, is to be your own advocate and understand your body and understand when things are not functioning properly.
I agree. And I also think it's really important to find a provider that has empathy for you and is just not glazed over and just thinks you're a statistic. Like, they actually care. They want to find out what's going on with you. They'll go to the moon and back to try to diagnose you, because some people just, they've seen so many patients, they're just so used to, like, oh, you're, something's wrong, and we'll give you some medication to, to subside it for now. But it's all about early detection. And if you don't catch it early, it's very detrimental. And cancer doesn't only affect one person, it affects the family, the mother, the brother, the sister, the community. So it's really important to jump on it while you can and speak up. So if something is not right, your body's communicating that you're exhausted, you're tired, it's not normal, go get checked out. It's really important to do that.
Yeah, never be afraid to get a second opinion. And I speak on this as a medical provider. We make mistakes, and Brandi's right. Cognitive bias is a real thing, especially in the civilian side. So when I have a young, otherwise healthy patient come in, I'm not going to think cancer, because that's just statistically how this works. It's not common. But given your specific exposures and risk factors, of course, it's a huge concern. So advocating for yourself and not being afraid to get a second opinion, because this is your life. Nobody's going to love you like you love yourself. I'll tell you that right now.
Exactly.
They call it the medical practice, the practice of medicine, for a reason. It is a practice. We are practicing, and so we're not always 100% right. And it's scary to think, but always seek that second opinion, seek that external validation, because nobody is going to love you like you are going to love yourself, hands down. So that's a big one.
Having a provider in
Here's a
general is also a good one, because I'm sure Kayla can tell you as well, because like, I'm one of those guys. I did not have a primary care physician at all, because I'm just a dude and that's what I do. I just don't expect that I
Typical
need
male.
a doctor whatsoever. Yeah, typical male, typical Marine. Like, I just don't think I need one until I need one. So also having a provider in general is also a good thing.
Yeah, go to the doctor. And like before everybody got in the chat, we talked about that. And in the military, we're so used to being told what to do, how to do it, when to do it, where to do it, what to wear, how to walk, everything. And so that's why, and statistically, suicide is the highest during the transition out of service period. And I think, all of us are former service members. So, I mean, it is a tough time period, that transition. And so you're always thinking about, what am I supposed to do? Never be afraid to be like, hey, I got to set up an appointment to go to the doctor. Especially active duty, you're right there during your transition period out. They have these seminars and they're painful to sit through, very painful to sit through, but sit there and listen to what they have to say when it comes to medical, because they will get you squared away before you even leave service. I personally didn't even go, and I had somebody pencil whip it, and I paid for that. I definitely paid for that long term. So never be afraid to speak up and ask. Get a healthcare provider. Just do it. Just have it there. But yeah, in terms of the autoimmune disease, sorry, there's a massive hornet in my house. Terrifying. That's terrifying. So for the autoimmune disease and conditions, we have looked into CVID. We have looked into myasthenia gravis. We have looked into SLE, and I could definitely get more resources for those specific conditions related to exposures over to Donna, and she can send it out. That's not a problem.
I sorry, I didn't see who it was that said it. Betty, yeah, I 100% agree. That's the main reason why I never went to the doctor when I was in. There was no chance I was about to miss my second appointment. So yeah, I totally understand how that goes. And we're not all the same, but we have the same mentality, and it's 100% you need to get yourself checked out. So being the advocates for your significant others to make sure that they actually take care of themselves is a big thing that you need to make sure you get taken care of.
I think Chelsea's fighting the hornet right now.
That's terrible. I bet you're right. Well, your stories are incredible. And I think all of the colleagues and friends that are HunterSeven supporters that have been on the call or other military members that have either been faced with a diagnosis or have someone else that is facing a diagnosis. It is amazing to hear your journeys and what you all have done to battle your illnesses. So you are all dynamic, though, that you guys definitely are striving and doing good things. So keep going. And the Military Women's Memorial is very proud to be connected with HunterSeven. And we will indeed be doing more of these seminars. And Chelsea and her colleagues will give us the information that we can share out with everybody. So, and they all of the seminars have been recorded, so they are all more information to be shared with your friends and to be researched.
No, thank you for putting this on and sharing the information.
Yeah, it's really great. So thank you. Chelsea, did you get him?
No, nope.
As long as he doesn't get your dog.
I got my tennis racket.
Oh my God, a tennis racket. That's so funny.
That is so not going to get him.
It's an electric one.
Oh,
Yeah.
Getting
Great.
I'm
state of-
really grateful for this. This is great. I wish that this was something that I saw post and pre-deployment, to know what to be looking out for and to know that these things are kind of lurking around while you're deployed and this is a possibility. I would have definitely have paid more attention to what was going on in my surroundings and, you know, my symptoms of stuff. And I feel like this could, like a seminar like this and just educating the soldiers before they leave, like that's incorporated before they deploy. So they know what to look out for, because it's all about early detection. If you come down with a cough and you haven't had a cough and, you know, and it just keeps lingering on, that's a symptom of something, you know, and that could be cancer, or that could be some other type of disease later on in the future. But if you would have caught it sooner and known what to look out for, some sort of outline or blueprint, you know, that you can document, that would have helped out tremendously and potentially save a lot of lives.
I know as a medic, I met a lot of, you know, strong-willed people. They never wanted to get medical care or anything like that. And my husband's still active duty, so I get to see soldiers or whatever. And sometimes, you know, I tell them what I've been through or my story. And the hard thing I've noticed is a lot of them are like, you know, you've only deployed once. That's just bad luck. Like my husband has spent 60 months overseas. All but 6 months were in combat areas. Mm-hmm. And he has been exposed to so much. So a lot of his friends or even him sometimes are like, meh, we've already been exposed to enough, or, you know, so much, like what's one more thing? And it's like, no, it adds up. And then of course, sometimes I feel like I'm the, you know, I don't want to say crazy one, but, you know, like I just feel like my brain's always running, you know, super fast with all this stuff. And it is hard sometimes to, when you tell other soldiers or other people, they're like, nah, I mean, that's just bad luck on your part. That would never happen to me. And like, I never thought, like, even as a medic, they don't teach you anything about cancer. Why would they? I was, you know, healthy 24. And so it is like a disconnect, I think, between the healthy military population and then, you know, the people that got sick.
Yeah, I talked about this at the White House when I was there the other day. Thanks again for that, Chelsea. Really, what I wanted to do was be on camera at the White House. No, I talked about this with them. It's like a lot of the times when it, like for us, like we knew, like we're sitting there watching this stuff burn. It's like, we know it's not healthy. It's like looking at a pack of cigarettes, you know, it's not healthy when you pick it up to go smoke one. But at the same time, you just sit there and you go, well, this is what it's going to be. And that's why I'm so thankful for this PACT Act. And then also, like, you know, Chelsea and everybody over at HunterSeven taking care of this and like looking into it, because we all look at it and went, oh, it's not healthy, but I'm not going to worry about it now. Now taking care of us on the back end, that's really the biggest thing right there. And we got to expand it, obviously, because certain people are still being left off of it, which is banana lands. But yeah.
Just wait till they make you and Brandi go back to the White House. Kayla, if you're unlucky enough, we'll fly you across the country. You can have dinner with the president.
Just anything to spread awareness. So
Exactly. I would be honored to. That's a huge platform. Do you know how many people would hear about toxic exposures, sarcoma, cancer? Like, that's huge. That is like a dream come true. I could die tomorrow and be happy. Not really.
Knock on wood.
Thank you.
But yeah, thank you all so much. And sorry for my abrupt issue, but thank you all so much for taking the time to talk, and the Women's Memorial, especially for allowing us to do this. You know, it means a lot to me personally as a female service member, but also as a healthcare provider. So thank you all very much. And, you know, we appreciate your time. So thank you. Dawn, I'll hand it back over to you.
So the Military Women's Memorial also thanks HunterSeven and all of our military members that are participating today. Being able to bring this relevant information to our military men and women, the families that are connected to us, we absolutely are looking to do more and more programs like this so that we are providing interesting and important material to our military. So HunterSeven, I can't imagine the important work you do.
I don't get a lot of sleep.
No, I can't imagine you do. So,
Okay, it's worth it. Worth it.
all right, well, we'll circle back and make sure that we get all of our information on our website, and then our team will have to inform me how we bring it out to everyone that's been signed up on the various programs. But I would imagine it's then also on our website and possibly on your website.
Yeah, I'll have some stuff sent over to you based off the questions and all that.
Great. Thank you, everybody.
Will we be able to share it? Can you give us a link to share on our social medias as well?
Yeah, yep. We should be able to do that.
Okay, great.
Great.
Thank you guys very much.
Thank you, everybody. All right, stay well.